So my own journey of melasma was quite a painful one. I had been treating hyperpigmentation for a number of years before melasma affected me. I've had two children who both led to hyperpigmentation on my face. For me, it tends to happen on my forehead, my cheekbones. And until I'd gone through that myself, I didn't really understand the pain of it. The first thing in the morning when you brush your teeth, you're scared to look in the mirror. That had never happened to me before. And going through it, I think, makes it a lot easier for me to identify with my patients because I've been through it myself. So typically where it affects is the forehead, the nose, the cheekbone area, and the upper lip. It tends to get worse in summer, tends to improve in the winter. And there are two main causes for melasma. Number one is UV damage, and number two is estrogen. That's the short answer. But when people come in and see me, they actually want to know more detail, which is what I want to pass along to you now. So there's two main causes. When it comes down to chronic UV exposure, there are three things that are taking place. Number one is that we have damage of the cellular membrane. That leads to free radicals, and free radicals trigger the melanocyte. That's the first thing that's taking place. The second thing that happens is that the mast cells get triggered. Those are cells that hold a chemical called histamine. Histamine, again, triggers the melanocyte. So that's the second thing that takes place. The third thing that happens is that we have damage of the basement membrane. When that takes place, we actually get migration of the melanocyte down into the dermis. That leads to deep dermal hyperpigmentation, which is very difficult to treat. So what I tend to say is don't wait until it's become neglected dermal pigmentation. Treat your melasma early. The earlier you treat it, the better your results, because you want to be treating epidermal pigmentation, not dermal pigmentation. Those are two completely different conditions. Now, the second part of that answer is estrogen. So why is it that estrogen leads to melasma? Well, we all know that hyperpigmentation tends to take place during pregnancy. It also tends to take place when you're on the oral contraceptive pill or if you are on HRT therapy. So estrogen basically increases the rate of your tyrosinase, which means that you're getting more melanin production. In addition, it increases the melanosome transfer. So that basically means that more parcels of melanin are being transferred to the keratinocytes around it. Those cells then come to the surface, and that's when you see the pigmentation. So that is a long answer for why you get hyperpigmentation due to estrogen and sun damage. For any other questions that you have on melasma or any other form of pigmentation that's affecting you, please do email me and I will be responding as quickly as I can.